I'm Dr. Gerald Deas. Welcome to Health Center from Downstate Medical Center. You folks looking out there, looking at me today, I'm a physician and I practiced internal medicine. Internal medicine is when you get out of medical school, you maybe do 3 years of specializing in internal medicine. But there's another specialty that's even takes in all the different things, surgery, obstetrics and gynecology and medicine and all those things, and that's called the new residency we have called family practice. Now, they didn't have that when I was here at medical school. I went Downstate Medical College, graduated in 1962, and they didn't have any programs like that, so I took internal medicine. But if they had a family practice residency, I would have been in that, because that's like 3 or 4 years after your medical school of training in all the disciplines of medicine, and which is wonderful, because when you go to one doctor and they see the children and they see the elderly and they see the person who might be pregnant and things like this, that's taken in the whole family. So that kind of practice is a much more wonderful practice in a sense, because you really get into the family. That's why it's called family practice. And Dr. Miriam Vincent here, who's the head of the whole family practice program here, professor of family practice here, she started out here after medical school. She also went to medical school. She's one of my friends one of my students that I had at York College years ago, Miriam Vincent. In fact, I drove her for her interview here, and now she's been here 30 years, so you know how old I must be. But the thing is that she set up a family practice department here that's wonderful. They have so many applicants to come to this to study family practice from all over the country, or in fact not the world, because this is such a fine program of of learning and teaching and treating people. Today I'm going to introduce you to one of those family practitioners, because I think that you'd be surprised of her background and how she's sitting here today. Not only is she assistant professor here in family practice, and it takes care of the residents and teaching and seeing patients at the same time, and walking right in the footsteps of Miriam Vincent, who's the head of the department. She's doing wonderful work in family practice. I want to welcome Dr. Mtomboti. Mtomboti. Mtomboti, that's right. Okay, that's fine. That's all right, because you see, I want folks to know something about our doctors here in family practice. Now, basically, when you first of all, let's get a little background on you, because everybody wants to know how people come into medicine. Does it start off as a little girl? Does it start off because your father's a doctor? Does it start off? But anyhow, what's your origin? What country are you out of?
Oh, I come from South Africa.
Okay.
Yes. I grew up in South Africa. I came here when I was a little older, like maybe 22 or so.
Right.
Yes.
And when you were in South Africa, what village or what part of South Africa were you in?
I'm from Natal. It's called Natal. Things have changed since post-apartheid, the division of the different areas.
Right.
But where I came from is Natal. It's close to Durban.
I see.
It's a little city called Pietermaritzburg.
I see, right.
Yeah, most people know Durban because it's like a coastal city.
Right.
But Pietermaritzburg is actually the capital of Natal, and that's where I came from.
Right, and you now you started off. You started off in public school there. Of course, you went to high school and college there. Is that right?
I went to high school there, all my education in South Africa. I actually, after completing high school, I did a diploma in medical technology.
Okay.
So I worked a little bit in the medical lab.
I see, right.
So I have a lot of interest in the scientific field, from way back then.
Right. But when did you decide that you would like to become a medical doctor? Was that along the time you were working in the medical laboratories or medical labs?
Well, even when I was in high school, I had that as an idea.
Oh.
But it was difficult for a black kid in South Africa during those times.
Right, sure.
As you may recall, that's the time that we were under apartheid rule.
Right, sure.
And, getting a quality education as a black kid that would gear you, to actually going to study medicine was not something that I thought was possible, even though I felt that this is something that I would have wanted to do.
Yeah, surely.
So instead of going to medicine, because I couldn't at that time, I did the medical technology, which actually paid me a little salary, while I was training.
Yeah. We always look at African American doctors and the doctors of the places where, like South Africa, how difficult it was for all of us to get into medicine. It was very difficult for me to get into medicine. There was only 2 blacks in my class here, and that was in 1962.
Wow.
1958. I was only 2 blacks, and he was from Aruba, and he was a Phi Beta Kappa from Howard University. Leo Stewart was Dr. Leo Stewart, and so was only 2 in my class. So when you went to medical school, which medical school did you go to, and how many, South Africans were in it?
Wow. Well, I went to medical school right here at Downstate.
Oh, isn't that wonderful?
Yes.
So actually, you made that transfer. What college did you go to in preparation for medical school?
Okay. When I came in '87, I went to Hunter College.
Okay.
I had to kind of do the whole BSc, the whole 4 years.
Right, yes.
So I did my BS for 4 years at Hunter College. And after that, I worked a little bit. I worked at Montefiore Medical Center at the lab, in the virology lab there.
I see, right, okay.
Since my specialty, or should I say my major, when I graduated was medical technology. So
Right, yes.
I worked a little bit in virology lab.
Right.
And as I was working there, they would have some residents, the Albert Einstein residents, come in to do a rotation in virology.
I see.
And, it kind of inspired me. I felt that, this is really what I want to do. I want to be a doctor.
Oh.
And I see these residents coming in here for the training.
Yes.
And I think that kind of jolted me to work hard and get the MCATs and start to really
you say
get my
MCATs, what are the MCATs, so folks will know what MCATs are?
I hope things haven't changed,
No, it's still
because
the
things
same.
change so fast.
I know, but
those the courses that or the exams that you have to take
right,
in order to enter medical school.
right, yes.
And it's
sure.
quite a rigorous
Definitely.
process.
Oh, yes, yes.
Just getting into medical school.
That's right.
Um,
And not only
but
that.
here I am.
Yeah, here you are, but not only that, but not only did you have to take the MCATs, but you had to have certain science courses and things at Hunter College.
Oh, yes.
And you had to have grades to even apply to medical school.
Definitely.
Yeah, right.
So, well, fortunately, I was really good at the sciences. And I think even though the education in South Africa may have been inferior, I was quite prepared when I got to Hunter. So I did very well in my science courses.
Right.
So
right.
that helped, in the application process, because it's really rigorous.
Yeah, but to make that transition from South Africa to Hunter College, to Downstate Medical College, folks look at us or look at doctors sometimes and think it's kind of like an easy path, but there's so many barriers that are put up in front of you as you try to achieve, and I'm sure that you had all of those even from the economic point of view, the money that it takes to go to medical school.
Definitely. But, fortunately in this country, if you do the right thing,
Sure.
fill in the right papers,
Right, sure.
make the necessary applications, you can get in. You can get a little help from somewhere.
Yeah.
So that's what I did. I applied, and when I did get into medical school, I did get assistance from the school,
Right.
which was very helpful.
Oh, that's wonderful.
So I think anything is possible if you really put your mind to it.
That's what you just said there, put your mind to it, A lot of our children today are not putting their mind to things, and they have all the opportunities. I always said to myself, or said to students, if I could take a group of African-American students and take them to South Africa and see what the children are doing there. Now, you might say the education wasn't up to par with other places, but I'm sure those children, you were impressed, like you were in school, public school, of wanting to learn.
Yes. Discipline was the main thing.
Yes.
And I think that's what's carried me through.
Right.
All the time is discipline.
Right.
And, you know, even like I said, education may have been a little inferior, but we were disciplined. We did what we had to do.
Yeah, right.
Did
sure.
all the homework,
Yeah.
and my dad wouldn't accept any less.
Right.
You know, he was very strict.
Isn't that wonderful? You know. Now, when you graduated from college, did you have any folks from your home to come up to see you graduate?
Oh, yes. My sister was here.
I say, right.
Yes. She was here for my graduation from medical school.
Oh, I see. Okay, your
Yes.
sister.
Yes.
Your mother and father still living?
No, my dad passed away
I see.
about 20 years ago. My mom is alive. Yeah.
That's alive. I know she must be proud to see you as a physician, though,
Yes.
to go through all that you had to go through to achieve what you achieved and be here sitting at Downstate Medical College, not only as a physician, but in the whole programs. Now, at Downstate here, do you see patients as well as teach and all the other things that you do? Give me some of your duties, because I know I see you walking down the hall. I know you're full of all these kind of things that you have to do.
Yeah, I have my hands full, but
yeah.
I enjoy what I'm doing.
Right, sure.
Yes. So, yes, I see patients
All right, okay.
in the clinic in Suite B.
I say, right.
I have like 4 sessions a week
Right.
of patient care. This is the best part of medicine, actually.
Right, sure.
You know, seeing patients and doing what you really worked hard, you know, to achieve.
Right, surely.
All these years.
Mm-hmm.
And, of course, most of the patients that I see look just like me.
Right, surely.
Yeah, mostly from around the area.
Right, surely.
Caribbean patients mostly.
Mm-hmm.
And I live right in the neighborhood.
Right, oh yeah, surely.
And sometimes I see my patients walking up the streets.
Right. That's very comforting, too.
Yes.
You know, doctors will have that tendency to be invisible in front of the neighborhood sometimes because they don't live in the neighborhood. I practiced for 42 years in the neighborhood in Queens. You know, I had my office downstairs and I lived upstairs.
Right.
So I raised 3 children upstairs, and my wife worked in my office, the children worked in the office, and then plus I had a lot of young ladies as my receptionists from the area, right from the block almost that I lived on, that passed through the office as receptionists while they were going to high school, you know. So these are the kind of things that I try to do to promote that young people to go into medicine, because we need role models out there. And, you know, you certainly are role modeling right here at the hospital.
Well, I hope that even the kids in the neighborhood, when they see me, because most of them are aware that I'm a physician.
Yeah,
You know,
right.
sometimes I talk to them, and
Yeah.
I hope they'll be inspired.
Yeah, surely.
You know, because it's just a matter of, you know, doing the little tasks that you have to do.
Right.
You know, from college,
Right.
I guess from high school.
That's right,
But
sure.
then college,
Right.
and once you get to medical school,
Yes.
it's the same thing.
Sure.
Doing the little tasks.
Right, sure.
This is what Dr. Dupre used to say.
Yeah, right, surely.
You remember Dr. Dupre?
Oh, yeah, sure. Yeah, yes. Now, did you, go ahead, I'm sorry.
She would say, everything is just a little task.
Little
Just
ta-
complete.
li-
And
that's
this
right.
too shall come to pass.
That's right. Little tests. I have always did that step by step. You know, I never had, I had to dream at the end, but I never thought of achieving that dream by jumping over to it. It was little bits, you know, because for me to get into medicine, not only did I have a Bachelor of Science degree from Brooklyn College, but I had a master's in biochemistry. I also had a master's in public health from the University of Michigan, plus served 2 years in the Army. So I did 6 years before even going into medicine as such. And so, but the little tasks, they were big tasks in a sense, but they were little tasks in a sense of achieving, you know. Now, in South Africa, to get medical care as a child growing up there, was it provided by black physicians or white physicians, or how was it, or hospitals or clinics or missionaries?
Okay, let me just say from my background, my mom actually was a nurse, and she
Oh.
worked in a physician's office. So we got all our medical care from him.
Oh, I see.
And
Okay.
he was an Indian doctor.
Indian doctor. I see.
Yes.
Okay.
But otherwise, the rest of the community would go to the community hospitals,
I see. Right.
which, you know, are not that great in that there's no space, no beds. You know, places like Baragwanath Hospital or Edendale Hospital, you know, where I come from, you'd have patients actually sleeping on the floor.
Yes. Right.
You know,
right,
which
right.
is
When you go
quite
back to South
difficult.
Africa for a visit, do you visit some of these hospitals and see it as
Well,
such?
actually, one of my sisters is a sister at one of the hospitals.
I see.
So now and again, I would go and visit. It's much better now. Things are
Yeah.
much better. You know, people can go to whatever hospital that they want to go.
Oh, I see. Okay.
You know, things are a little better than when I was growing up.
Yeah.
at least.
Right. Right. And of course, AIDS has been a big problem now in South Africa, hasn't it?
Big problem. Big problem. And, you know, for some reason, the government has been in denial for a while.
Yes.
Now, I think they're shaping up, and, you know, but it has devastated the country.
Right. Right.
A lot of deaths from AIDS every
yes.
day.
Yes, yes, and that's a hard disease to take care of in many ways, not only from getting medication, but just the side effects of AIDS, you know.
Yes,
all
just
the
the
systems.
poverty, the
poverty.
poverty, because even though things are better, you know, these masses of people who are underprivileged and who don't have the means
Yeah, right.
to provide good care for themselves.
That's right,
Just
yes.
the basic necessities,
Right.
like a good nutrition.
Yes, right, surely.
You
Oh,
know?
yes, good nutrition. That's the basis of all health, in a sense, you know. But I would say that looking at you now and doing what you're doing, you're gathering a lot of good information, a lot of good training that I think one day that you might return to South Africa in some way to either supervise or to at least lend some good advice to medical care for the people there.
Yeah, I would say.
Yeah.
Actually, family medicine is big in South Africa.
Yeah, right, surely.
And the great thing about family medicine is being able to do a lot of different things.
That's right.
Yes.
That's right.
So sometimes you'd have a physician for a rural community to do everything,
Right, surely.
right?
Yeah,
To take care of children,
Right.
right? The adults in the community,
Sure.
those with
Pregnancies,
mental problems,
Mental problems, yeah.
Yes.
Yeah.
and now AIDS.
Right, surely, surely,
Right?
surely.
So even though we don't do that here at Downstate, because
Yes.
we have other specialties over here,
Surely.
in family medicine we do the same thing,
Right, surely.
right? Take care of children, adults, right?
Yeah,
The
and-
geriatric population.
Yeah, yeah.
We are actually the first physicians of first contact for the patient.
That's right, surely.
You know,
yes.
we're the ones who coordinate the care.
That's right.
You know,
Orchestrate the care. Yeah, that coordinate and orchestrate, because it's nothing like seeing your physician, even when you're in a hospital, for example. Say if you admit the
yes.
patient, a lot of times some doctors might just admit the patient in the hospital and not see them from the emergency room, you know, and never see them again. But in family practice, if you admit that patient, you take care of that patient.
oh yes. Actually, the way we have things set up in our institution here is that all the patients that the providers in the clinic in Suite B, all those patients that they see, if they're admitted to the hospital, they actually take care of those patients inpatient as well. So they would call us first.
Yes.
If a patient of mine is in the emergency room
Right, yes.
and is having a heart attack, even though they have their cardiologist,
Right,
they would call me first.
right.
You know, and this is great for the patients
It
because
is.
usually they know you better.
Right, and they have trust in you.
Yes.
You know, yes, because hospital is a strange place. I don't know if you've ever been a patient, but I have too. It's a strange place if you don't know the face that's walking in the room. You know, your heart beats faster, you sweat, you know, people don't have the same kind of touch to them, you know. So that family practice is just a wonderful thing. Like I said, they didn't have it when I was here as a intern and resident. But I made my own family practice. What I would do is take a year. I would take 6 months of medicine, and I would divide the other 6 months up into 2 months of, say, ophthalmology, 2 months in ENT, and 2 months in this to fill it out. And over 3 years, I had all these different disciplines, even rehabilitation medicine, dermatology. I'd have 2 months in ENT, 2 months. And so I had all this vast thing, but I had to make up my own thing, because after you take 6 months of medicine, you really don't need another 6 months of medicine. You've seen enough during that time, you know, so you can, spread it out. And so, family practice has been a love of mine all these years, and certainly Downstate has provided good doctors such as yourself. And I know that you do a lot of the taking care of the new doctors that are coming in also, don't you?
Oh, yes. Yes. I'm actually the clerkship director for family medicine,
Right.
which is a third-year clerkship that introduces the students to primary care.
Okay.
You know, so
Medical
I
students.
yes, medical students.
So you're teaching medical students in the third year.
Yes.
Oh, that's great.
And this is exciting because, usually brings you back to basics.
Yeah. Oh, yes.
Yes.
Oh, yeah. And because it's nothing like the basics. I wish sometime they could take doctors that. In fact, my head of medicine when I was here, Dr. Ludwig Eichner, after he finished retired at 65, he came back and went back to medical school for 4 years right here at Downstate. He was my chief of medicine here when I was a resident. He came back to see how it had changed. Teaching has changed, and things like this. Yeah. But you get such a broad knowledge in family practice. That's why I keep advocating it, and and knowing that what you're doing is a marvelous thing. I hope that you'll be able to one day take some of these wonderful practices that you had and take it back to South Africa to a degree where you can at least institute some policies and things like this. I know they probably have quite a department. People always think of Africa as not having modern hospitals, but they're modern, quite modern today.
Yeah. Well, we did the first heart transplant.
You sure did. You sure did. That's right.
Yes.
Well, we have a doctor here at Johns Hopkins. He wasn't even a doctor who showed the head surgeon, cardiac surgeon, how to do the correction for blue babies. Dr. Evelyn Thomas. He was just a technician, but he was so good doing this kind of operation that they had to learn from him, So we have our abilities, and we're trying to encourage more. What do you think now of just Oprah doing the wonderful things she's doing right there now?
Wow, that's a great gift for South Africa.
Right, yes.
I mean, I don't know. If I were to meet her, how I would thank her. It inspires me, and I think other South Africans who are out here to do something.
Right,
you know,
surely
to
go
give
back,
to give
back
a little bit.
That's right.
Yes. I think it's the greatest gift she could give.
Well, that's
us.
the thing that I think that you're in a position to do also, is that when they have the school in full bloom, to go back, even if it's for a couple of weeks or a year, and let them see what the possibilities are, even if you didn't have the same advantages that they had, and they certainly should be taken. But as I saw them on the screen talking, they were some wonderful, motivated people, the students, And now she's thinking about using it for boys. But I think that we have enough African American doctors in this country to do the same thing. We shouldn't have to have waited for Oprah to do that, because we have the American doctors here, African American doctors, who are well, ability to have started things like that, to go back and do things like that to the motherland,
Yes.
But as a closing point, I'm just so glad that you're here with us, and that you're doing a wonderful job here, doctor. And I think that your family should be so proud of you. Your mother's still living. And how many sisters you have?
A lot.
Okay, how many?
Like 8.
8. That's not big.
We had 8. A lot.
I know, but
one brother.
One brother.
Lots of nephews and nieces.
I bet. But it's so good having you here on the program with us, though. I told you that it'll be a wonderful discussion to have you come on the show here and know the work you're doing here. And Dr. Vincent's department and
Yes.
family practice. And we hope that this is not the last time that we can get into some of the other things that you're doing. You have any hobbies?
Yes.
What's that?
Tennis.
Okay.
Always looking for a partner to play with.
All right. Tennis. Huh?
Yes, I love
Right.
tennis.
Okay. Right.
Mm.
Any other hobbies and crafts or anything like that that you do?
I'm good with my hands in general.
Right.
Yeah, I can sew, I can knit, I can do other stuff
Well, I know you
besides medicine.
can. Well, there you go. And you folks out there, she can do a lot of stuff with you here in medical practice.